So one thing that's for certain is this community needs more access to advanced cardiac care. We now have electrophysiology services, which includes implanting pacemakers and defibrillators. We'll have a cath lab. We'll be able to do cardiac catheterizations, angioplasties, and stents. And the reason why I say this community needs advanced cardiac care is because there are disparities in the outcomes of patients who have heart attacks depending on where you actually have the heart attack. So if you have a heart attack in Syracuse or Rochester and you're close to a bigger hospital, you're close to a cath lab, you're actually going to do better than you will if you have a heart attack in Auburn where you have to travel to get that advanced care. That this was something this community needed, that we needed to improve healthcare outcomes in this community. A cardiac cath is the best test that you can do to detect a blockage. If somebody's having a heart attack, you do a cardiac catheterization, you can clear the blockage. That's life-saving. Obviously prevents death, prevents arrhythmias, prevents congestive heart failure, prevents suffering. If we can do that closer to home and patients won't have to travel 45 minutes or an hour, that's going to save lives. That's going to improve the quality of life for our neighbors. A couple weeks ago, a patient came in with a heart rate of 10. A heart rate closer to 60 is a lot better than a heart rate closer to 0. So, when they come in with a heart rate of 10, their blood pressure is low, they're dizzy, so they need a pacemaker. 3 or 4 years ago, if that patient had come in, they would get pads slapped to their chest and basically a jolt of electricity to get their heart rate up to 60. It's quite painful every time you're getting the electricity delivered to increase the heart rate. Dr. Obasari was able to take that patient to the operating room and quickly implant a pacemaker, which in that case is life-saving. I believe Dr. Zachary also had a case like that recently. So with the additional doctors that we have here and with the facilities that we're going to have, we're going to be able to really improve the lives of people in our community.